Good afternoon. We are here with Dr. Georgina Caballero, specialized in internal medicine.
Good afternoon. Thank you for coming.
Hello. We're going to ask you some questions about diabetes mellitus. The first one is, what caused the disease?
Well, the disease is caused by an insulin resistance that it caused an hyperglycemia because the receptors of the insulin doesn't work, so the glucose stays in your blood vessels, so it elevates it.
Okay.
How serious is it, and how does it affect the patient lifestyle?
Well, it's a very serious disease because it hasn't cured, so it affects all your lifestyles. So you have to be careful with things you eat, the things you do, the injuries you can have, because it affects your blood circulation, so you can't cicatrizar, no sé cómo se dice.
It can heal, puedes decir.
It doesn't, your skin doesn't heal the same way, so it's a very difficult disease.
What is the short-term and long-term prognosis of this disease?
Well, there are very diseases that are caused secondaries from diabetes. One of them is a vascular disease, a heart disease, because of the hyperglycemia that stays in the vessels, it obstructs them, so you can have like myocardic infarcts. You can have also problems in your eyes, in your muscles, in the way you walk. The people have issues with the walking, so they stop walking and they have pain after they walk. They have kidneys problems too, and there is a disease called diabetes foot that is caused by the hyperglycemia, that some injuries in the foot doesn't heal well, so it causes ulcers that grows and grows and don't heal the proper way.
Okay.
What symptoms does the patient present?
Most of patients present polyuria, that is the increase of urinating, polydipsia, that is the increasing of thirsty, and polyphagia, that is the increase of eating. So these patients get obese, they get fatigue and muscular debilities.
Okay. Ahí tantito del paciente que nos estamos basando.
Sí, por eso es lo que te
¿Es ese? Okay.
O lo repito, tipo de que my patient has, my patient presents.
Eso.
Okay. Entonces solo repito la respuesta, ¿verdad?
Sí.
Okay. Well, my patient presents polyuria, that is the increase of urinating, polydipsia, that is the increase of thirsty, and polyphagia, that is the increase of eating. She also presents obesity and fatigue and muscular debilities.
Perfect. How can the patient be tested for the disease, and what do these tests reveal?
Well, the glucose is measured in blood samples, so you have to be no eating for 8 hours to take these blood samples. These blood samples measures the glucose in your blood, and they have to be between 70 and 156 milligrams of glucose in your blood. So there, you can measure them like that. Another method is called tolerance glucose curve, that the patient eat. Another one is called tolerance glucose curve, That first you take a sample, then the patient drinks a water with sugar, and they drink the water, and 2 hours later you take another sample and you compare the measurements. And the third one is a dextroxis. This is not a diagnosed measurement, but it helps the patient for taking their medication properly.
Okay.
What treatment is the patient receiving and how effective is it?
Well, the treatment that my patient is receiving is metformin. The metformin is the most useful medication in diabetes. It controls the weight loss, it controls the sugar blood, it controls all kind of endocrinology disease. So my patient is taking this and is also taking pioglitazone. The pioglitazone it helps for the glucose to stay in the receptors for glucose so they can work well. And the patients also need, like my patient, to do exercise 4 days minimum and a healthy diet.
Thank you so much for your time.
No, you're welcome.